I'm Cathal Summers.
And I'm Deirdre Glynn.
Your Teagasc Sustainability Advisors, and you're welcome to the Teagasc Environment Edge podcast, bringing you the latest information, science and opinion to improve farm sustainability.
Superintendent Veterinary Inspectors Caroline Garvan and Damien Barrett join us on the show to chat about the upcoming Department of Agriculture, Food and the Marine's Animal Health Awareness Week.
With animal health having been identified as one of the main potential abatement measures in the Teagasc Marginal Abatement Cost Curve, how can it help to improve efficiency and reduce our emissions?
What are the environmental implications of antimicrobial use for both animals and humans? And why is it so important to have a robust animal health plan in place on the farm? I started off by asking Damien what the objective of Animal Health Awareness Week is.
Animal Health Awareness Week evolved from recommendations from a review of our early warning surveillance system a couple of years ago. And one of the key elements of that review was that for us to detect an emerging disease or an increase in increased levels in what we would consider endemic diseases, well, diseases that are here all the time, we felt that there was a need to increase the awareness among the farming community about what good health looked like. And when they knew what good health looked like, they'd also become more aware of what ill health did, and how. And we, while the an exotic disease outbreak might garner the headlines, endemic disease is probably much more costly to individual farmers. So we have from the whole idea of Animal Health Awareness Week was to make farmers more aware of the costs associated with these endemic diseases, but also to be aware of and be vigilant for any emerging disease like blue tongue, foot and mouth, something like that.
And Jamie, would the exotic diseases, would they be linked to imported animals?
Yes, they can be linked to imported animals. That's definitely one way that they could be introduced to the country. A disease like blue tongue could be introduced either by, say, it's a midge-borne disease. It could be introduced by midges being blown from an infected area in Europe. But I think more realistically, it's going to be walked into the country through the importation of cattle, most likely cattle, I suppose. But then there are other diseases like, say, African swine fever, where the threat would be the importation of meat products from areas in which African swine fever is present.
Damien, you mentioned endemic disease. What do you mean by endemic?
Endemic diseases are those diseases that we have present in the country and that are present on not necessarily on all farms, but they're present on a lot of farms. The diseases I'm thinking particularly here would be something like diarrhea, respiratory disease, pneumonia, parasitism, common, and maybe I suppose TB could also be considered in that it's a disease that we're not free of, essentially.
Yeah, and you mentioned midge-borne disease, that's worrying to me because there's a lot of midges around here. But with global temperatures rising potentially over the next couple of years, is there potential for that to become more of a problem in Ireland?
Oh, very much so. There's a couple of elements to that. There's the increase in temperatures. That's basically means that the midge season could be extended. Our understanding was that the midge season ran from, say, April to October, November, with the indications are that could be stretching from possibly March until December now. Increased rainfall also brings its own risks, in that we've seen that a greater incidence of the like of rumen fluke and liver fluke in the last 10 to 15 years, and they've extended into areas in which they weren't previously all that common, but that is a result of increased rainfall.
And Caroline, Animal Health Awareness Week has been run in conjunction with World Antimicrobial Awareness Week. Can you tell me a little bit about that maybe, and what does it hope to achieve?
Okay, thanks, Cathal. Well, I suppose in some ways the clue is in the name. The week is there. It's being held to try and increase awareness and particularly understanding of antimicrobial resistance. And it's something we've been doing now for the last number of years. We've been having this week to increase people's understanding of the role that they play in addressing antimicrobial resistance. But I suppose it's to explain what it is. And effectively what it is it means that our antibiotics that we've been used for the last nearly 100 years are no longer working. And without them, certain diseases we can no longer treat. And so it's to keep the antibiotics that we use currently in both ourselves and in our animals, it's to keep them effective. And I suppose it's about highlighting the threat of antimicrobial resistance and also the role that we can play, the actions we can take to address it. I suppose particularly because we share the same antibiotics across the two populations. And there's also highlighting now increased focus on the environmental role of antimicrobial resistance, because every time you use or you take an antibiotic, about 60% of that antibiotic is excreted into the environment. And there's huge concern now that you have all these, apart from having antibiotic residues in the environment, you get these antibiotic resistance genes developing. And so the bacteria in the environment that we can pick up, that we are exposed to, have these resistant genes, which means we have less treatments against these bacterial diseases.
A lot of the medically important antibiotics that are used in the country at the moment, 70% of them seem to be used by animals, not human beings. I suppose that's quite interesting as well. It tells its own story.
Well, I think, yeah, Deirdre, there's a lot of focus on the level of use in both humans and animals at the moment. I think it's fair to say, though, there has been a reduction in the level of use in the animal population in Ireland from 2018 to 2019. We had a 10% drop, which is very, very positive. But at the same time, because in actual gross tonnage, there's more used in the Irish human population, but because the animals weigh so much more, there's more being used in the animal health side. And as you say, there's some drugs of last resort in human health that are still used in animals. And if you have residues of these antibiotics in our wastewater, in our soil, and then there's resistance genes developing in bacteria, we are then exposed to these bacteria because they're circulating in the environment, and there's a risk then that when we go to hospital, the antibiotics won't work.
Yeah.
It's quite worrying, really, isn't it? You know, if you think about the revolution when we got these medications into the world and how it changed the world and how it changed humanity, really, and animals, not just humans. But if things start to go wrong, and we can't control, I suppose, bacteria or issues maybe with these kind of medications, we're going to be under severe pressure. And am I right in saying that the bacteria that's been affected could potentially affect either human or animal? So depending on who's using it, it can affect the other.
Absolutely. And we carry out surveillance now for zoonotic diseases like Salmonella or Campylobacter, because the same bacteria that causes diseases in the animals can spread across to ourselves. And indeed, it's gone the other way. We've seen it in companion animals where it's gone from the dog to the owner. So, you know, we're in this shared environment. We talk about the One Health concept, and that's because there's such a huge link between human health, animal health, and then environmental health. So if we're contaminating the environment with antibiotics that are being excreted from the animals that we've treated, and then these antibiotics are causing resistance in certain bacteria, then, as I said, we are exposing ourselves to these bacteria, for instance, through our water, and we're at risk then of picking them up. And we might never have taken an antibiotic ourselves, but we're still picking up the resistant bacteria from the water, for instance, the water that we're swimming in the sea. You know, we're all very closely linked now.
Damien, I suppose as part of our knowledge transfer programme, advisors encourage farmers to have an animal health plan in place. Why is good animal health so important from a sustainability perspective?
From a sustainability perspective, I suppose livestock are getting a lot of bad press, as you're well aware of, and it's predominantly through the issue of biomethane. And I suppose we can argue the rights or the wrongs of it, but I think it's fair to say that biomethane is at the heart of this debate. The issue with methane is that it's considered from a greenhouse gas perspective to be, I think, about 23 times as potent as carbon dioxide, but it doesn't remain in the environment as long. But I think there is going to be an onus on livestock farmers or cattle farmers and sheep farmers to reduce the level of biomethane production, and this can be achieved through increase in production efficiency as much, if not by reducing numbers. And for example, you may have seen there last week that our minister said that a 3-month reduction in the age of slaughter age could result in a 12% reduction in the level of greenhouse gases produced by beef animals. But for that target to be reached, animals need to be producing at an optimal level, and good health is a key part of optimizing that production efficiency, as well as that reducing levels of culling, and I suppose making sure that all animals on a holding are at work, essentially, that they're not, for want of a better word, hanging around having a holiday with, say, very long calving intervals or anything. Like, basically an animal that's productive or non-productive is going to be producing relatively similar amounts of methane. So it's important that they're working and are producing as efficiently as possible.
Yeah, that's very, very true.
That's a massive one, isn't it? Trying to finish animals off even a little bit quicker across the globe would make a huge difference.
Yeah.
Even we can focus on fertility, EBI, and we all have had animals at some stage that even something like maybe a case of pneumonia or something as a calf really sets the animal back as they get into their lifestyle, and it really puts them back trying to finish them.
It's interesting you mentioned about pneumonia, because I was just in preparing for these podcasts, I was doing some research, and I saw one reference said that a severe case of pneumonia as a calf had the potential to increase calving intervals by up to 12% over the lifetime of the animal. So that's the after effects of this the consequences of this ill health are not just the here and now. There could be over the lifetime of the animal. So it's important and the first year in life, and even the first 6 months, like, that's where the bulk of the ill health is going to occur. So it's critically important that the health of that age cohort is maximized.
So health plan and management, good management, yes, are crucial, really.
Correct.
And just to compound your point there, Damien, if we look at the Teagasc marginal abatement cost curve, or the MAC curve, as a lot of people know it now, it's designed to find measures that I suppose reduce greenhouse gases across the farm, and it costs them, be it positive or negative. But the fourth greatest abatement potential for an individual measure is actual animal health on that cost curve, and not alone that, but it's a cost saving to the farm. So it's nothing but positives, like just to invest a bit of time with your local vet, maybe.
Yeah, I think there's the great benefit about sustainable farming is that it's profitable. I think if we were to optimize these efficiencies, I think it's a win-win, both for the environment and for the farmer from an economic point of view.
Caroline, a lot of people have some awareness around issues regarding antimicrobial use, but can you tell me what the environmental implications are?
Well, the environmental implications are that every time you use an antibiotic or an antimicrobial, at least 60% of it goes into the environment, and that serves as a reservoir for the resistance genes, if you like, that then are picked up by the bacteria that cause the disease. So you're feeding the development of resistant bacterial disease each time you use an antibiotic. So it goes back to Damien's point about animal health. Then you have this resistant bacteria that's more costly to treat, less effective treatments available. So again, it comes into the whole sustainability issue. healthy animals mean less antimicrobials, mean less AMR resistant bacteria in the environment. So everything is interlinked. And, you know, the less antimicrobial resistant bacteria in the environment, the better for ourselves. Because in 2019, there were over 5,000 recorded, and I mean, this is an underestimate, 5,000 recorded hospital antimicrobial resistant infections, and there were 250 deaths. Now, they say that's an underestimate, but it's a real public health concern. And so, you know, anyone that's using antibiotics has a responsibility to use as little as possible. So it goes back to the whole thing of healthy animals don't need antibiotics. It's down the road of vaccination that we need to go. And again, it has been shown in research, possibly by yourselves, that, you know, the use of vaccination, while an initial cost, long term you have a quicker finishing time, you have better productivity, better live weight gain, and the cost of any disease in terms of vet bills, medication, and, you know, impact on productivity is huge. So it's all about disease prevention, optimal animal health, but the environment, I mean, we all have a responsibility now to watch our environment and to keep it as free of antibiotic residues and resistant bacteria as possible.
Caroline, I think you make a really valid key point there, that it goes back to that old saying that we've heard for years: prevention is better than cure. And I just go back to what we spoke about a second about the sick calf. And 20, 30 years ago, we always had a few bottles of penicillin sitting up on the shed, and if you saw a calf getting a little bit shook, you'd inject it straight away. But now I suppose there's a massive sea change, and we're gone to the stage where we're looking for better facilities, better housing, trying to reduce, I suppose, those kind of things happening to try and reduce the amount of antibiotics.
Absolutely, Cathal. I mean, it's not about firefighting anymore. It's about looking ahead and predicting what kind of issues, looking at herd health plans. What diseases do I have every year on the farm? How can I better address them? And most of it goes back to biosecurity, whether it's hygiene, buying in, you know, looking after when the calves are born, dipping their navels, you know, all those little things. But the reality is there's new veterinary medicines legislation coming into force in the 28th of January next year, and a huge focus and the driver behind that legislation is to address antimicrobial resistance. And what that legislation is saying, you should only use minimal amounts, reduce your use of antibiotic, and your vet will not be prescribing vast quantities of antibiotics for you to keep on the farm. That's not going to happen. And they'll only be prescribing enough to treat the disease. And perhaps you may have one bottle left on farm, but you will not be having bottles of what we call drugs of last resort in human health care. So things like Baytril or Draxin or Barbacil, because they're used when nothing else works in human health. So we cannot be using them in animal health unless they're absolutely needed and there's nothing else that will work. So I think farmers will have to look and have different expectations from their vet. It's a bit like when we go into the doctor and we expect a prescription because we have a cough. If it's a viral infection, antibiotics won't work. So vets now will have to, have a different approach to addressing disease. But it does go back to prevent disease. It's antibodies, not antibiotics, that we want in our animals now. It's all about disease prevention.
Could potentially inappropriate use or high usage promote increased resistance passed through soil and also through meat?
Absolutely, Deirdre. And there has been research done on looking at wastewater and sewage, and they have found, I think there was an EPA report out last week, that there are still 30 towns discharging raw sewage into our water, and they have found highly resistant E. coli in our waterways. And even though we have monitoring in place in this country under an EU water framework where they check for levels of E. coli and another bacteria, an enterococci, but they don't check for the resistance in the bacteria. And they have found, NUIG have done a lot of research on this, they found very high levels of E. coli that's resistant to these drugs of last resort that I've just talked to. So it's out there. And, people might say, well, I've never taken an antibiotic. How did I get this? But it could even be from drinking water, swimming. Everyone's back swimming in the sea now. But, if there is discharge going in and if it hasn't been treated, because some of the wastewater treatment will not remove these resistant genes. So, it's a melting pot, if you like. Everything is swimming around together. We're there, the animals are there, and these resistant bacteria are out there in our water, in our soil. And I just might mention, actually, we're doing a nationwide soil survey starting next month, where we take soil samples from 10,000 farms, and we're checking for resistant E. coli in those soil samples. So that will give a really good, it's the biggest survey ever been done in Europe, give us a picture of what's going on in our environment.
Excellent. Damien, the Department of Agriculture, Food and the Marine are running a webinar series for Animal Health Awareness Week. Can you give us some of the details about the series?
These are going to start on the 18th of November. I'll speak on the ones on animal health first, and maybe Caroline will come in then on those that are more focused on AMR. We're having a webinar on the 22nd. It's One Health, focusing on zoonotic disease, and we're going to have speakers from our first speakers from the UK, from a group over there that look at zoonotic risks, which I'm involved with each month, and they do risk assessments on zoonotic diseases that are on the radar for both the veterinary and medical worlds. We're going to have a speaker from the HSE on Irish, what are the common Irish zoonoses, speaker on tick-borne fever. I suppose ticks are becoming more prevalent as grazing areas are. Some areas are undergrazed and they carry a threat. And there's also a speaker on the threat of salmonella from dogs that are fed raw meat. We're also having the final webinar on the 24th, and that's going to be about emergent threats, and we'll have a speaker on foot and mouth disease, a guy that diagnosed foot and mouth in Northern Ireland in 2001, and just recounting his experience, the threat of blue tongue, how biosecurity is important for controlling low path avian influenza. We've speaker on African swine fever, the veterinary contribution actually to the NEFID modelling. If you remember, COVID is actually considered a zoonosis. It's spilled over from animals. And we're also going to have a speaker on recounting or describing as how the value of antimicrobials that worked in immunocompromised patients, how important that is. So Caroline, do you want to talk on that, on the other webinars that have more of an AMR focus?
Yeah, thanks, Damien. So just to quickly go through, on November the 18th, which is European Antibiotic Awareness Day, we have an AMR webinar. We have two speakers on the human health side. We have a professor from NUIG, he's a consultant microbiologist, HSE lead on AMR, and he's talking about his experience in the hospital side of how things have, the challenges he faces finding antibiotics that will work. And then we have a GP who'll speak from the community side, the challenges she faces in terms of, the buildup of resistance to certain treatments. Then we have a pig farmer who has managed to various strategies to reduce his use of antibiotics on farm to practically zero. And really his key message is he stopped using antibiotics and he moved over to vaccines and improved his biosecurity, his farm management. So it's just to show we're trying to have champions around this whole anti-AMR, series and show that it can be done. It's not just the department saying you should do it. We want to show that it can be done. And then we have a speaker from the UK who's giving the perspective of what they've done over there in terms of addressing AMR, both from an economic and environmental perspective as well as from a health perspective. And then the third seminar is on the 23rd of November. It's focusing again on herd health and highlighting the importance of proactive herd health planning in both maximising animal health and reducing your AM usage, which obviously reduces AMR. So we have a speaker talking about the use of bulk milk testing as a herd health management tool. We have a speaker from the UK who's a sheep health consultant talking about a program they developed over there, working to establish good antimicrobial prescribing between vets and their farmers, so showing again how it can be done. And then we have a focus on selective dry cow therapy, which will be very much, this is the direction of the new regulations, reducing your use, particularly no more blanket treatment with antibiotics. And then finally, we have a speaker on the parasitic challenges at farm level. And I suppose it's important to remind your listeners that from January the 28th, all antiparasitics will become POM medicines. So all farmers will need a prescription from their vet to prescribe these. To use these, but also to say at the environmental level, it's also been shown with the antiparasitics that they do have quite a significant effect on biodiversity, and it has been shown that certain antiparasitics have significantly reduced the population of the dung beetle, and obviously the dung beetle has a significant role in aerating the soil. So again, it's just showing the One Health, that everything we do impacts on our environment.
Yeah, look, we're big fans of dung beetles here, so we don't like to hear that happening anyway. But look, it's great to see such a huge effort being put into animal health and awareness, and really enjoyed the chat today. And best of luck with Animal Health Awareness Week. Thanks a million, Caroline, and thanks a million, Damien.
Thanks very much, guys.
That's it for this episode of the Teagasc Environment Edge podcast. Thanks to Superintendent Veterinary Inspectors Caroline Garvan and Damien Barrett for joining us on the show.
Don't forget to rate, review and subscribe to the podcast. You can listen on Apple and Google Podcasts as well as Spotify. And for more information, go to the Teagasc website at teagasc.ie. I'm Cathal Summers.
And I'm Deirdre Glynn.
Join us next time for the Teagasc Environment Edge podcast, signpost to farm sustainability.